Okay, so all right, so this is our investigative presentation on full knee replacements, specifically the CJR model. My name's Natalie.
I'm Claire.
And I'm Maylah.
Awesome. So, what was the need that led to the development of this device? The first need was the idea that people were living longer. This means that conditions were developing, including osteoporosis, which is the idea of unusual bone growth, arthritis, arthroplasty, hemophilia, gout, and so forth. In addition, there was also a need for the bilateral knee replacement. This included not just a partial knee replacement, but also the total knee replacement, which is a different kind of move for this type of development of device. In addition, there was also the idea of the death of bone and knee, which can occur because of blood supply problems, as well as maybe a knee injury or knee deformity through either loss of cartilage or kind of a birth defect. But our specific model, the CJR model, the main idea for this was the idea of cost. Cost was a huge factor for this product, and moving towards an approach that allowed for patients in Medicare or Medicaid to have easy access to a product like this at a lower cost was the main reason. What were the regulatory hurdles involved in bringing this device to market? First was the idea of the level of risk. So there's stringent information criteria based on a complete list of criteria, which involves bringing any medical device to market. Our device is not excluded from this. This included a list of FDA requirements, especially for higher risk devices. Also, the idea of the Medical Device Amendments of 1976 addressed this issue, and you need to undergo a list of processes and developments in order to even get your product to market. Also, the profit factor, the money to market. So you can only make a certain amount of profit before it kind of it's overregulated or kind of is being cut from the market in general, as well as complications in development. So the biggest things with bringing the total knee replacement to market was the idea of function and stability, as well as ligaments. Do you keep them in or do you remove them? This went through a complete trial and error process. Many models were created before the first total knee replacement was even brought to market. So our CJR model also underwent the same thing with the idea of the rate of complication. This includes like infection, implant failure, and then the risk associated with surgery, whether it be through anesthesia, anything else of a surgical procedure. Our CJR model went through a trial run. This is a newer model brought to market, and it went under a series of clinical trials. It's also continuously in a clinical trial up to today. The idea of readmission rates, whether people come back with injury or infection from surgery, including the FDA risk factor. So there's a mandatory registration for our device and at the analysis of the device in total to see if it was able to be brought to market. How does the insurance industry cover the use of this device? So the CJR model, this is specifically related to the idea of the Medicare Medicaid program, which includes a bundled payment. So the provider will pay in full amount, the fee-for-service payment, and then the services are furnished to the beneficiary based on their claim data as well as the actual episode payment. Parts A and B of the Medicare and Medicaid program cover different parts of the coverage aspect. If needed, you can also apply for a Medicare supplement plan, which can cover additional kind of that service for fee payment and kind of can be more flexible in what you actually have to pay for this device. In addition, you need a doctor's prescription for this specific surgery. It's not an elective surgery. You have to have a prescribed written order from a doctor in order to even apply and get your Medicare and Medicaid program to cover this device. In addition, you must reach your deductible as you would with any other medical procedure in order for Medicare and Medicaid to step in. So the joint replacement coverage of surgery is specific to that Medicare and Medicaid program. So specifically, our model has this new payment model. So this is, again, a new payment model. It's a trial run. They're still trying to work out the full logistics of this. It's only used with Medicare and Medicaid, and it's not available everywhere. So you have to check and make sure that this product is available in your specific area. As well as CJR's new claim, they really want the new aim of this product to be 50% of all the Medicare, Medicaid fee-for-service payments to come from an alternative payment methods by the year of 2018. So that was just a couple years ago. In addition, the Centers for Medicare and Medicaid Services, that cost and coverage will vary depending on where you get this procedure done, as well as, access to this material. So how much does this device cost and procedure cost? So other models. So when we talk about total knee replacements, they're considered TKR models. Health insurance and coverage of Medicare and Medicaid can vary, just kind of like we talked about before. But if you have a private sector, such as Blue Cross Blue Shield, they estimated that it was around $30,249 with inpatient versus outpatient. It was around $19,002. So on average, including for what the full cost of the procedure and anything in between, the charge was around $57,000. So our CJR model kind of takes a different approach to this idea. The average Medicare expenditure, this includes surgery, hospitalization, and recovery. So that bundled payment ranges anywhere from $16,500 to $33,000, kind of depending on where you go. But this aim kind of reduces that cost factor, and it allows it to be more readily available for those Medicare and Medicaid patients, including that episode benchmark prices of the blend, baseline period, and regional pricing, again, on where you want to go with your device. So this is just a table including regions, fractures, and no fractures with how much this device would cost to get this procedure done. So these are all just, in dollar amounts, and you can just kind of see a wide variety of resources there. Yes, and now someone else is going to present.
All right. Okay, so now moving on to how many companies produce versions of this device. The top manufacturers in the United States are Zimmer, Biomet, Smith & Nephew, Stryker, and DePuy. Zimmer and Biomet, being the top two companies, decided to merge in 2015. So after this merge, this company held the lead in the top hip and knee replacement device sales. And today, more than 25% of knee replacements implanted worldwide are made from Zimmer Biomet. So now, what is the marketplace competition like? So the total US market for orthopedic large joint devices is growing at a rate of 1.9%. So this will take the 2017 market value of $7.5 billion up to $8.6 billion by 2024. So this means that orthopedic joint devices are growing. So because of this growth, the marketplace competition is intensifying to make the best type of knee joint replacement model for the least amount of money. And again, because of this competition, each company will need to be able to adapt to the new changing market environment to ensure growth in their own market share. So some examples of new developments in total knee replacements can be used like robotic surgery or utilizing 3D printing so that each knee replacement is unique to its patient. So how do producers view this device, and is it easy to use? So over 600,000 people undergo knee replacement surgery every year in the United States, making this an extremely common and safe procedure. There are standard procedures put in place to make sure that severe complications such as infection are very rare. They only occur in fewer than 2% of cases. So even though this is a very well-known procedure, there are still risk factors to consider depending on a patient's health history. Undergoing surgery is always a risk, and it can lead to complications if there are other previous health issues in place. So some of the risk factors can include undergoing anesthesia, blood clots, pain following surgery, allergies to metal components, and artery and nerve damage. So what does this device give the patient? Most patients will see a severe reduction in pain, improved mobility, and a better quality of life. The American Academy of Orthopedic Surgeons says that more than 90% of knee replacement patients experience a significant reduction in knee pain. So this is 9 out of 10 people who had a total knee replacement found that they had a significant reduction in their pain after they had this surgery. So most patients are between 50 and 80, but the procedure is based on a patient's pain and disability, not just their age. So because some patients may need a total knee replacement before hitting the 50 to 80 year age range, they will find that their knee replacement could wear down and they might need a new one. So this leads into what are some of the trade-offs with total knee replacements. Among nearly 55,000 people who had a knee replacement, only 3.9 required revision surgery within 10 years. And by 20 years, 10.3% required revision. And this was a study that was done by the Harvard Medical Journal. So because of these statistics, surgeons urge patients to wait as long as possible before undergoing a total knee replacement, so revision is unlikely. So some things that can help delay this process would be physical therapy, weight loss, and medication. So another trade-off when you have a total knee replacement is that you may not be able to engage in high impact activities anymore, such as tennis or running, but you'll still be able to do low impact activities such as swimming. All right. Now the next person will present.
All right. Yes. Yes. All right. So the knee replacement market in general, the knee replacement market is experiencing a pretty steady growth. In 2019, it generated over $9 billion, and it's projected to generate around $12 billion in 2026. That's about a 4.5% compound annual growth rate, CRG. Locally in the United States, like we mentioned already, there's about 600,000 replacements a year, and the average cost without the CRJ model is $57,000. So a few reasons for change in the market and steady growth is a rise in the geriatric population, which means more people are getting old versus the number of births. And that number is also expected to go up. So with age comes complications from wear and tear on joints, especially the knees, since we're on them all day. And like we mentioned, osteoporosis, and various types of arthritis can really damage those knee joints. Another reason for growth in the marketplace are technological. This impacts the way they function in the knee and also how the surgeries are done. So these technological advancements allow a greater increase in confidence in people who are a little less inclined to get a knee replacement because they aren't really sure how it works, or they're just a little sketched out about it. But with these technological advancements, people are more reassured that they are getting the most updated care based on a lot of trial and error, and the way that knee implants are manufactured and implanted are the most updated version they can get. So people are more inclined to go get them. Oh, oops. And advancements also allow people with outdated knee replacement components to go get replacements. If old metal component is eroding a little bit, they can go get another one with this brand new version of their knee replacement component. And so a few current trends in the market are new innovation and design of the knee replacement components. I'll get into that later. But these new innovations allow them to last longer and allow more functionality within the patient, which also can and this innovation design can also relate to the surgical procedures that are involved with knee replacements. So incisions are getting smaller and rehabilitation time is also getting smaller, which is less money for the payer and lightens the stress load a little bit for people who are a little skeptical about getting knee replacements. Another trend that's trending a little bit more is robotic assisted surgeries. So one example of this being beneficial to the patient is so when you get a knee replacement, you have to align the hip and the knee exactly straight with each other, because that's the way hips and knees are supposed to go. And when orthopedic surgeons manually do the straightening themselves, on average, they're about 66% exact with their alignment. But with these new technologies and robotic assisted surgeries, they are now around, on average, 99% accurate. alignment within the leg, which helps a lot with physical therapy. There's less physical therapy that someone needs to go to align their knee and their hip, and there's less repeated surgeries. All right, so the CRJ model, after being enforced for about a year, an evaluation showed that total payments in general decreased around 3.3%, and there was also a reduction in PAC settings or post-acute care settings. One example is physical therapy, and another example is post-surgery stay. So people who are post-op, they're able to get home easier, and they're not going through months and months and months of physical therapy. It's a lot quicker, both in the hospital and in recovery. One thing that was highlighted in this evaluation after a year was the health of the patient, the quality of care. Those things didn't change. So the patient, both in the control group and the CRJ model group, the health remained pretty aligned with each other. They had knee pain, they got a knee replacement, and they were up and moving pretty soon after that. And then the quality of care, how the patient reported they were being treated by the hospital, the insurance, the surgeons, nurses, all that stuff. They were pretty in tandem with each other, so there wasn't really a big impact there. All right, so the production and sale employment in the knee replacement surgery area, there are two pretty vital roles that came up in our research, which were the medical sales representatives and the orthopedic surgeons. So medical sales representatives, there's about 70,000 in the US. They represent the companies that manufacture the devices, and they also supervise the surgery. So a lot of people don't know that when you get a knee replacement, there's actually a medical sales representative in the OR, and they're there and they're watching, but they aren't allowed to touch the patient, but they are there in case something goes wrong. The surgeon is a little confused of some aspect of the component, or there needs to be resizing. The medical sales representative will bring in tools to resize in case that becomes an issue. And then orthopedic surgeons, of course, very important in knee replacements. There's about 25,500 in the US, and their job is to represent the hospital and perform the surgery. And they are supposed to, of course, use the device manufactured by the company that's represented by the medical sales representative. All right, so the actual knee replacement. There are three big components in a knee replacement. So there's a femoral component, which attaches to the inferior part of the femur, and it's supposed to replicate the medial and lateral condyles, which is kind of what the femur hinges on. And then there's a tibial component, which is hammered into the superior kind of surface of the tibia, and it replicates the medial and lateral grooves for the meniscus, which is what the femoral component hinges on. And then there's the patellar component, which the patella bone, your kneecap bone basically, is fully taken out, and it's replaced by this patella that glides on the femoral surface, or the patella surface, I guess, of the femur. And then, so there are a few types of knee replacements. We've mentioned the total knee replacement quite a few times. That's because it's the most popular. Around 85.9% of knee replacements are total. So that means all three components of tibia, the femoral and the patellar components, are all put in all at the same time. It's all totally redone knee. And then revision, we've mentioned a few times here and there. It's the second most popular, which is just an update of an existing component. So you need a new patellar component, or the femur one is a little iffy, they'll just take it out and put in another one. And then the least popular replacement type is the partial knee replacement, which is just a replacement of one or two components, but it's not all three. All right. And then there are three versions. So there's a lot of components, but there are three versions of a knee replacement. So the first one is a fixed bearing, It's the most popular, and it includes all the basic components, the femoral, the tibial, and the patellar. But in this case, there's an extra layer that's usually plastic on top of the tibial component, which allows the femoral component to hinge on that tibial component. And even though this one is the most popular, this version doesn't allow maximum strength or restoration to the knee, so it's recommended to be implanted in patients who are non-overweight, so there's not a lot of weight kind of on the knee in daily activity, and it's recommended for inactive patients, so there's not a lot of wear and tear going on. It's just a basic new knee replacement. All right, second is a mobile bearing. So it includes all the same components, but instead of this plastic layer that's on the tibial component, there's a rotating platform between the tibial component and the femoral component. And the flexibility and durability is just the same as the fixed bearing, but this version is preferred by younger and active patients because it has an increase in mobility. So it allows more movement rather than just the fixed bearing. In the picture, you can see this example of a dislocation. So not what you want to have happen in a mobile bearing, but that is a visual representation. All right, and the last one is a medial pivot. It's just same as a fixed bearing, but then again, there's no plastic component. It's just meant to replicate the original knee joint. So most knees don't have that plastic component. But instead of the hinge joint like the fixed bearing and the mobile bearing present, it's more of a ball and socket with the femoral component and the tibial component. But to wrap up, we hope that you guys learned a lot about knee replacements. We have all of our research in our Google Drive, and we hope you guys enjoyed. Yes.
Yeah.